Hello, my name is Dr. Dulangi Dahanayake. I'm a consultant child and adolescent psychiatrist, and today I'm bringing you a message on behalf of the Sri Lanka College of Psychiatrists. This is in regard to the COVID-19 pandemic and the impact it had had on the mental health well-being of children and adolescents. As you are all aware, the COVID-19 pandemic has resulted in disruption of the daily lives of all our children and adolescents, especially with the extended school closure, the lack of opportunity to meet up with their friends, lack of opportunity to engage in sports and leisure activities, and also being confined to their houses. Different children have reacted differently to this change, depending on their ability to cope, on their skills in interpersonal domain as well as intrapersonal domain, and ability to manage their own emotions. Children have reacted in different manners. Certain children have shown signs of stress. They have become more upset, becoming more irritable, becoming angry with parents and others. And also some children have become very tearful. They have withdrawn, they're just staying in their rooms, not talking to others. And certain children have also had issues with their sleep and appetite. They have not taken their meals as usual or even taken more meals than usual. And in this context, certain children have also shown what we call regressed behavior. That is, they are starting to behave as if they were much younger than their actual age. Children might resort to thumb sucking or bedwetting that they have overcome as they were growing up. So how do we help these children as parents and family members? The most important thing is to attempt to establish some sort of structure and routine into your daily lives. Because when in giving this structure and routine, we are passing a message to our children that we are in control and that things are going smoothly. Because it's extremely important that the children feel reassured and in control of what is happening. So another thing that we need to do when we are planning the structure and routine for their children is to make sure that there are leisure activities and other family activities incorporated into this. Because it's very important that children spend adequate time with their family members and have the opportunity to express their fears and worries, and the parents respond it into an adequate manner. So if your child comes up to you and expresses fears and worries, please do not brush it aside. Listen to them and talk to them about it, and try to instill hope that we will overcome this and that things will get better. But be realistic, because otherwise children will lose faith in what we are telling them. And then we have to also model behaviors. As parents and as adults in the children's life, we have to take care of our own mental health. A lot of us have had mental health difficulties because of what is happening during this period. And it's important that we take care of our own mental well-being, because by modeling, we are showing our children that it's possible to take care of our mental health and feel okay during these tough times. Another important thing is about watching news items, because sometimes children get really distressed when they have to watch a lot of news. So it's important that we restrict exposure to these traumatic news items, while at the same time giving some realistic information appropriate for the particular child's age. Because some children might not be able to grasp the more important and sort of more distressing news. So in this context, we have to always be firm and be mindful of the limits that we set for the child's screen usage as well, because that is also becoming a big problem during this COVID lockdown, with a lot of children resorting to excessive screen usage. And we have to also model this by staying off screens and having family time. In addition, especially for the older children, we have to encourage them to engage in their studies as well. We have to support them in their learning and moving forward with their studies and other expectations in life. And another thing that we can do to help our children is to give them some control. So the control can be for small activities like planning out the meals at home, planning out what they want to wear, depending on their age. And helping others is also a very good way to make children feel in control and feel good about themselves. So please don't hesitate to help other people. And if you have any further concerns, please don't hesitate to contact our toll-free line on 1926 for further information. Thank you.